cases along the border, but officials are saying they aren't connected.
The World Health Organization is now issuing guidelines on how to deal.
Well, the flu pandemic's back, as we all know by now. It's pretty bad. So I'm just going to do a bit of an overview of what's been going on this week, which has been pretty devastating to us in North America. And then I'm going to answer some questions from one of my subs, Jim Wright, who's asking me some questions about pandemics, given the fact that this has caught a lot of preppers out. So as everybody knows, just after the last video last week, flu cases spiked everywhere, as far as I can tell, causing total pandemonium. We'd had large volumes of flu cases for the last 3 to 4 weeks. They'd tailed off for about a week or so. Most schools had reopened, cinemas had reopened, bars had reopened, everybody was getting back to normal, having gone through a bad flu season. Sorry, I don't feel great myself. And yeah, wow. So starting basically Wednesday night, we started to get mass quantities of patients coming in with severe respiratory infections, and we quickly got overwhelmed. We did what we'd done, and we kind of knew what to do, and we opened our second emerge and all the rest of it, but very quickly we got swamped. We've been averaging about 200 to 500 cases a day for the last 5 days in our hospital alone, and all the other hospitals are as bad. And out of them, about being cruel, about 100 or so need to be admitted. I mean, as far as we can, we're sending people home with written instructions from family. The ambulance service is pretty much at a standstill. Wait times for ambulances for major accidents now are up to like the 10 to 12 hour range. So people are being told, get yourself to hospital. They're also, of course, being told, don't go to hospital. It's really chaotic. Food supplies are starting to run out in a lot of the areas. And this has come right out of the blue. Nobody was expecting this. So I'll just show you some images of what's been going on this week. Of course, one of the first things that's been done is everywhere's got their old flu hand washing signs back up, and cover your coughs, use your sleeves, all that sort of stuff. So that's been spreading around everywhere. Hospitals are actually physically closing all across the GTA and Canada and North America and Europe and Asia. Basically, we're so overwhelmed that we're just basically saying we're shut, and we're letting paramedic services, such as they are, decide who's getting to the hospital or not. We've actually been trying to staff the emerge with police, because our security, they're all sick and there's hardly anybody there, and there's quite a bit of anger breaking out from the population because they want to be fixed, and there's a lot of young people coming in. The first wave that we got, and this is now being called the second wave, we didn't really see so much of the younger population, but we're seeing a lot of children and a lot of 20-year-olds, and they're just not coping well with it. So hopefully this is going to peak soon, but my goodness, it's terrible. This is just a picture of as we were setting up the new emerge, the secondary emerge area. If I didn't photograph it now, there's like 400 people literally in there. We've ran out of stretchers, and we actually ran out of mattresses on the ground, so we're telling people to try and bring their own camping gear, and it's like that bad. And you know, the signs are up all over the world now. This is an official global pandemic that's killing a large number of people. Of course, the press and the government are telling everybody, don't panic, just take a week off, stay in bed, keep calm, it's not going to kill everybody, don't panic. But you know, I'm panicking. This is not what we had last month. This is not Asian flu. This is killing a lot of people. We're averaging 100 or more deaths a day in my hospital alone. This is a catastrophic flu. Where people are going out and where pharmacies are open, everybody's trying to get the flu shot. The flu shot, as far as I know, is going to have no effect on this particular strain of the pandemic. They're still desperately trying to work on a vaccine. Airline travel, where it is still being allowed, nobody's travelling anyway. It's the same with trains and cars. Just nobody is travelling, and everybody's like hoping this ends. One of the things the governments are doing here in Canada is they're saying everybody should be isolated. They're saying everybody needs to be isolated at home. They're making it voluntary. I mean, they can't really make it involuntary. We don't have any police available to enforce any of this stuff. But people, by and large, are following the messages. All our schools are completely closed, all the kindergartens are closed, all the swimming pools are closed, everything is shut down. And a lot of the grocery stores are now shut, and because they ran out of food, but also people aren't showing up to work. Pretty much everything's been shut down. There are a few church services going on, but like hardly anybody's going. This isn't great, but we are officially in phase 5 or phase 6, depending on which guidelines you use. This isn't a pandemic that's global, that's here, that's everywhere, and it's killing lots of people. So yeah, the schools are all shut down, and borders are being shut down to foot traffic as well as car traffic everywhere. People are trying to desperately control what's going on. So I'm just going to show you some video I took when we went to work, just to show you. Like, this is rush hour in Toronto yesterday. It's kind of scary. Literally hardly anybody about, and I can't really blame people for staying at home, but what I'm questioning is what's going to happen when they actually run out of food. I'm sure the government's trying to figure it out, but I can tell you that the hospital doesn't have enough food supplies, let alone medical gear. We don't have enough food supplies to maintain staff staying on site because they can't travel back and forth. It's becoming a real issue. Gasoline is mostly still available, but you can see the obvious signs that it's running out. The tankers, the trucks, they're not on the road. People aren't leaving to go to work. They're either too sick, or there's somebody in the family that's too sick, or they're too scared, and I can't really blame them. So I'm just going to finish up with answering some questions from a great sub of mine, Jim Wright, down in the United States of America. And I think a lot of us who work in healthcare tend to overlook what normal people think and what normal people's questions are. And I'm going to put up the questions and I'm going to answer them. What great questions. So medical gloves, what are you going to buy? I would suggest going to auto shops for a lot of these supplies and buying polyvinyl gloves. You can buy a lot of them fairly cheap, single use, throw them away. Nitrile gloves, the hospital type gloves, are the best to get. So you can actually get really expensive neoprene gloves. I don't think you need to. Latex gloves are widely available, but a lot of people have latex allergies and I don't find them the greatest. I would prefer PVC gloves or nitrile rubber gloves. That's what I prefer. Now, one of the things is you want to know whether if they're powdered or unpowdered and what the difference is. Well, the difference is actually it's cornstarch. So if you buy it unpowdered and get a bag of cornstarch and put a little bit of cornstarch on your hands, it does the same thing. But there is a problem with powdered gloves. So the powder actually can cling to your skin and it can cause a lot of sensitivity and allergies. And in hospitals we don't actually really use powdered gloves anymore for that reason. Now, one of the things you want to know, is latex the best choice? And I would say it absolutely isn't. I would definitely go with nitrile gloves. A lot of people have latex allergies, nitrile gloves tend to fit better, and basically they don't puncture as easy. And I think that's the one we should be thinking of. So whenever you see nitrile gloves, and they're going to be called medical grade because that's what the hospitals are using. So it used to be thought most flu spread by hand to mouth contact and hand to cup, and then somebody else's hand to their mouth. Recent research is showing that droplet spread, aerosol, you just breathe it out and it spreads around, you inhale it and then get infected that way. It's actually much more significant than we ever thought. And certainly this superflu seems to be like that. So I think you need masks if you're around other people who might be infected. Now there's a simple surgical masks. Now all the research has been done on them pretty much show they're a waste of time in terms of not catching anything. They're better than nothing, but they're not very good. N95 is about 75 to 99% effective, and I think the critical key here is that although some research has shown it doesn't matter whether it's fit tested or not, I think it's important. If you've got access to N95 masks, buy a few of them, put them on, get a really strong smelling thing, open after the mask is on, and do this kind of thing with the mask on. And jump up and down and bend. If you can't smell it, and then breathe deeply. If you can't smell the smell, if your glasses don't fog up, and you need to have glasses on or goggles on preferably, if you're dealing with anybody who's infected, the mask's effective for you, and that's what I'd recommend. But if you're just out and about in the public, a couple of bandanas are going to do you, because you're going to keep social distancing, you're going to keep 3 yards away from people, okay? The only real use of the N95 mask is if you're actually nursing or in a room with somebody who's infected. So don't be on transport, don't be in offices, don't be at church, right? Don't be close to other people without a proper mask on. gas mask, gold standard for NBC, right? Or CNBC, whatever you want to call it. The gas mask, I have problems with it. The problems I have with the gas mask is when you put them on, you have to make sure they're very tight and a very strong sealing, and they're not that comfortable for prolonged use, and you're basically only ever going to use this if you're in direct contact with somebody who may be infected or is infected. My main concern with gas masks, other than the price of them, is that when you take it off, although you'll see pictures of people just ripping them off, that's because the mask wasn't on properly. If you have a gas mask on properly, it's a real hard thing to do to take it off without touching yourself. It's really difficult. That's why I would say go with N95 for this. Cost and everything else. You don't want to be out and about in public anyway, and if you are, keep social distancing, and an N95 will work just fine. Gas mask, vision difficulties, looks kind of scary, plus people are starting to panic, they might want your mask. If you do have a gas mask, change the filter every 24 hours and treat the filter as infected. Now this is a great one, disposable gowns or full coveralls. Now for me it depends. If there's blood and faeces that you're dealing with and cleaning up, then I would go with a full suit, and I'd go with an impermeable suit. For general care, I'd go with a disposable gown if you have them available. That said, what I'm really recommending is you go and get a whole bunch of plastic pennies and use them. Keep your arms uncovered and use good hand and soap wash technique. Take the gown off carefully, the pinny off the kitchen apron off carefully, put it in bleach, let it air dry, let it sun dry. That's what's, you just need the barrier so it's not actually touching you. And the main part of the disposable gowns in hospitals is to remind staff not to touch themselves until they've washed their hands. Anybody that's ever done any painting in a Tilex waterproof suit will tell you you're going to sweat like anything. What we did at Toronto General during SARS in 2003 is we actually wore running gear, running shorts, running t-shirt, you know, the expensive running gear, and we wore that underneath all our gear we were putting on top. Even so, we had staff pass out. We literally had to crank the door open after gowning up and drag them out by the feet, clean them up, degown them, and then hydrate them. It's a really serious issue, especially during the summer. At the moment it's pretty cool. Now, this is what I'd be thinking. If you guys have any ideas, please chip in. Jim wanted to know what other than the obvious, what should you be looking out for? So what we have noticed in past events is a steep rise in heart attacks, specifically in the elderly, in a period of 1 to 3 days prior to the flu signs coming into the hospital. Nobody's quite sure why. They think it's because early flu is causing atrial fibrillation in the elderly who are vulnerable, but that's something I would look for. So if you know a healthcare worker, and you should, ask them to text you if there's any infectious diseases that seem odd, if there's any spike in heart attacks, if there's anything weird going on, just to give you a text so you can have some information first. The other one is healthcare workers tend to get this sort of thing first. We are very much the canaries in the coal mine, so that's something you might want to look out for as well. You also want to look out if they start to close schools down and that sort of thing. Just be generally aware of the fact that you're going to get information that's going to pacify and reassure in the early phases of pandemic. Be hyper vigilant. It's much better to go to the bug out location for a couple of weeks, unexpected holiday, call sick at work, and wait to see what happens. By the time the pandemic's in full bore, you're already infected. I wasn't sure what Jim's asking here. The government will want to keep their people from panicking, but are there any subtle clues that one could watch and listen for to ensure they stay safe? So I'm basically the usual stuff: avoid crowds, including transit, get your gasoline and food when people are not likely to be around, use gloves and alcohol rubs and all that stuff when you're getting food and gasoline. Rinse down store-bought items. Remember, the shop people may well have virus on their fingers and touching the material, and it can last, depending, possibly 24 to 48 hours on hard surfaces. We don't know exactly for this specific virus, but I would be looking at caution. Years ago I saw a great sci-fi book that said the governments would just put porn on TV 24/7 to keep the males at home as the world died. So I don't think there's a lot you're going to find out as a tip-off in advance. Cancelling elective surgery in the hospital is a classic prep for any major event like war or expected terrorist event or any of those things. When there's a serious threat, the governments generally tell the hospitals to cancel elective surgery. So again, no healthcare workers. The other one I would think of, if you know local law enforcement, there is a possibility, I think, that they would be issued with pandemic gear. in the early phase. That's certainly what we've seen in Toronto, is our cops have been given a lot more body bags. They usually carry a body bag, and they're carrying more, and they're carrying a lot more masks and a lot better type of paper masks than what they would normally carry. How long does a pandemic last? Well, it's going to last probably 3 to 12 months. It depends. There's usually 1 to 2 to 3 waves. There can be a 4th wave. Most classic flus will have 1 wave, possibly 2. This one is definitely going to have 2 waves. This is definitely the 2nd wave crashing into us. Great question. Something I would just totally overlook because of my background. He's wrong here. What he's saying is if a disposable suit needs to be changed every day, a household with 4 occupants would need a large amount of protective gear. Okay, the classic thing that killed people in SARS and in Ebola is reusing personal equipment. So whatever personal equipment you use, whether it's disposable or non-disposables, arguments for both, use it once for each contact with each possibly infected person and degown carefully and all the rest of it. So if you've got 4 people and all 4 people might be infected, the best thing you do is not sit there all day wearing gear, but actually be sitting there not wearing gear in separate rooms. And then when you actually have to contact each other, which should be kept to extreme minimums, then you would wear personal protective equipment, and then when you separate again, you would take all that equipment off. Again, setting up pandemic areas in the house and all that stuff is going to be very much dependent on money and geography and number of people. And right now I'm starting to figure out what I'm going to do with that. Don't share toilets, don't share towels, don't share showers, don't share cutlery, don't share plates, don't share clothing, all of that stuff. This is one situation where MREs, a few cases of MREs might be a good idea, so your kids can make their own food, and you know, again, it depends. You can buy things. It's going to be difficult. You have to figure out what you're actually capable of doing and do the best job you can. When flu spreads, flu's contagious, depending, in the first 3 to 4 days after their illness begins. Most people can infect people. This is flu, not cold. I'll put the symptoms of both up at the end. Flu is infectious for at least 24 hours prior to you having any symptoms. This is why it's spreading. This is why quarantine is important before symptomology occurs. I can't stress this enough. Just because they look fine and they have no temperature and they feel great doesn't mean they're not actually shedding large amounts of virus into your mouth parts. Okay, bear that in mind. 7 to 8 days is basically what we look at in terms of how long afterwards when you've got rid of symptoms. So what my message here is in this particular pandemic is quarantine everybody for 14 days. If at the end of the 14 days they have no symptoms, no temperature, you should be taking temperature twice a day when they get up and when they go to bed. Temperature will be highest at 3 o'clock in the afternoon, so try not to take the temperature at 3 o'clock in the afternoon. So you can't buy it anymore, but if you can get hold of Tamiflu and the new virus agent, which I can't remember the name of, I've got access to the Tamiflu. It's actually useless in preventing flu. What all it does is reduces the flu length by about 1 to 2 days, and generally for most people reduces symptoms. Again, there is some suggestions that in young teenagers Tamiflu can cause severe significant brain injury. It's not proven, it's hard to do studies, but I would be very cautious giving this to anybody under the age of 25. Antibiotics won't do anything for flu. You should not take antibiotics during this phase. It's really not going to help you, and you don't need them. That being said, one of the killers from flu, and what we're seeing at work, is secondary bacterial infections of the upper airway and the lower airway. So I'm just going to list 3. There are better antibiotics, but the ones that you can get from pet supply stores, and they still have them available, and I would do a rush order and get these right now if I was you, is amoxicillin, ceftriaxone, azithromycin. Read the instructions, read the side effects. Get these 3 antibiotics. There is a suggestion that amoxicillin actually is no use anymore for bacterial infections. I would still get it as it's widely available for pets. Certainly the other 2 are effective. So look at these slides, figure out, is it flu, is it bacterial infection? If you have flu, is bacterial infection starting? When you actually know what you're dealing with at that point, if it is bacterial, start antibiotics. But for flu and colds, rest, hydration. Get some powdered Gatorade in. That's still kind of available. You might want to check out sporting goods stores for this sort of thing right now, powdered Gatorades. Get different flavours, because honestly, if you get sick and you have to drink a lot of it, you get sick of the same flavour quite quickly. You can buy the pre-made bottles and stuff of it, but it's kind of expensive, and I find it too strong. I always make Gatorade about half strength, and there's all sorts of things you can do. So I hope this helped, Jim. Anyway, everybody stay strong and stay safe. This is really, really a smashing, awful pandemic, and who knows where it's going to go. So I will be, if I'm able to, I'll do another vlog next week, and hopefully at that point I'll have some good news, but right now the news is terrible. Stay safe, everybody.